Welcome to this month's Masterclass about melasma. So for the next 10 minutes, I'm going to tell you everything you've ever wanted to know about melasma. And if there's something I don't answer, please DM me, come on to one of my Q&A lives, which is every week on Tuesday, and ask me the question there. But I'm going to try to answer everything possible about melasma in the next 10 minutes. So what is melasma? So melasma is what we call macular pigmentation that happens in patches. So it's in the skin. You can't feel it on the surface of the skin. And it tends to occur on the forehead, the upper cheeks, on the upper lip as well. It can also happen on the nose. You can also have extrafacial melasma on the body, but that generally happens in menopausal or postmenopausal women if they get melasma. We think melasma is hormone-induced, meaning it is related in some way to either the use of the combined contraceptive pill or potentially to pregnancy. So that's why it's often referred to as the mask of pregnancy. Lovely. So you generally know if you have melasma, it's symmetrical. It's like a mask in patches, and it's pretty difficult to live with because it's difficult to cover with makeup. It doesn't really conceal very well. And I find that my patients with melasma, they wear tons of makeup and they're just never happy because it's never concealed properly. So that's what it is. Now, it's a chronic condition. So it's something that you will have a tendency towards and will be lingering there perhaps for the next good couple years. But that doesn't mean it cannot be well managed. And by well managed, I basically am saying it should be cleared as much as possible. And with the appropriate correct treatment and ongoing appropriate maintenance treatment, you should be able to clear your melasma and keep it away. So one of the biggest myths about melasma is that it doesn't ever go and it's permanent. It is to a point, but you can clear the pigment to virtually nothing at all so that you either see nothing or perhaps a very faint shadow of where your melasma was, but you can definitely get it clear. And I have done that many times with probably now at this point over 1,000 patients because I basically treat melasma every day, all the time in my patients constantly. I wrote a really big paper about melasma a few years ago. And that was published in a major journal where I talked about my treatment ladder and an evidence-based treatment ladder for melasma. And that is the type of treatment I use still now on my patients, and it works extremely well. So anyone who tells you melasma cannot be treated is lying to you because it definitely can. And I have many hundreds of patients who will attest to that fact. So that's good. Now, the treatment of melasma is relatively straightforward, okay? I don't treat melasma with lasers, with needles, with facials, or with any weird and wonderful gadgets or devices that are going to cost you thousands of pounds. I treat melasma with topical treatments, so that's cream treatments. They are prescription cream treatments, and they are made in a specialized kind of lab called a compounding lab. I work in London and Dubai, and I work with 2 different compounding labs, one in London and one in Dubai. The products are slightly different, but they're the same medicines, so I get pretty much the same results in both places that I work and treat patients with melasma. I treat patients with melasma in all different skin colors and skin types. So the idea that only the darker skin doctors can treat patients with melasma who have darker skin is totally untrue. I can treat anyone's melasma because melasma is the same pathology in any skin color. It may look slightly darker if you have darker skin, but it's still the same thing. So there is no kind of rhyme or reason to the idea that you have to be of Asian origin or Indian in order to treat someone who has melasma if they're Indian. So that's, to me, totally a racist thing to say, and also completely untrue. So melasma, the pathology is the same in everyone, which is why it responds to the same treatment in everyone, okay? Now, the other big thing people always talk about is this whole idea that they have dermal melasma, which is difficult to treat. I only ever hear about that when someone's failed treatment somewhere else and some other doctor has told them, oh, it's not responded to treatment because it's dermal and not epidermal. All melasma is epidermal. From a histological point of view, there is no pigment in the dermis. That doesn't happen. It's always in the epidermis by definition, okay? So the whole concept of dermal melasma is totally nuts and totally untrue. The other thing people say a lot is that heat worsens melasma. So heat like saunas, hot showers, hot temperatures outside, cooking over a hot stove, these things don't worsen melasma. What can worsen melasma is if you have inflammation in the skin. If you do something to produce irritation or inflammation, like for example, a laser treatment or a very intense facial can make your skin red and inflamed, and that can leave you with post-inflammatory hyperpigmentation, which can perhaps make your melasma look darker. But there is no connection between heat necessarily and melasma getting darker. So that's another thing I would potentially not really listen to that either. So when it comes to treating melasma, there is basically one way to do it, and it's by using topical treatments. And the gold standard is what's called the triple combination cream, and that's a combination of retinoic acid in the form of tretinoin combined with hydroquinone and a little bit of topical steroid. Now the steroid is in there to balance out the cream. It is not going to cause any skin atrophy or any problems like that, even over 6 to 12 months of use, and that's been well established in clinical trials. Hydroquinone, I've done a video or masterclass about that a few months ago, so you can please refer to that if you have concerns about hydroquinone, but hydroquinone is completely safe to use under medical supervision in the treatment of melasma, and it can be used for extended periods of time. That's also well evidence-based. Hydroquinone is totally safe. It does not cause cancer. It also does not cause exogenous ochronosis pretty much ever. So I wouldn't be really concerned about hydroquinone from a safety perspective, okay? When used in the treatment of melasma, it is safe and effective, and it is the gold standard. When I treat melasma, I generally use twice daily hydroquinone. So I use a retinoic acid combination with hydroquinone at night with a little bit of steroid in it. And in the morning, I usually combine my hydroquinone with a little bit of glycolic acid because it helps the hydroquinone work a little bit better. And those products are always compounded. That means that it's one cream with all the medicine in the one cream. So one for at night and one in the morning. I generally treat melasma in a relatively aggressive way, which basically means I use a high strength hydroquinone to clear it quickly. And the reason I do that is so that you stick with your treatment, because I know you want your melasma gone, and I know you want your melasma gone as quickly as possible. So what I do is I give you the strongest possible cream that I think you can tolerate so that we can get your clearance of melasma to happen fast. And that's what keeps you using the cream. So it's the way that I keep you compliant with your treatment. Because the worst thing ever is if you use a cream for like 3 months and you see no change, especially if it costs a lot of money, then you'll just be like, what is going on? Nothing can help me. And it's really, really devastating and disheartening. And I do not want my patients to ever feel like that. So I give you the best treatment. I give you a good whack of treatment, and we aim for improvement in your melasma as quickly as possible. So that means that, for example, I'll use a 10% hydroquinone combined with the tretinoin and hydrocortisone to use at night. So 10% is the max I can prescribe here in the UK, 8% is the max I prescribe in Dubai. And in the morning, I usually start with about 4% hydroquinone and a 2 to 4% glycolic compounded, and maybe sometimes some hydrocortisone. It depends a lot on the patient. So where I start people in treatment is dependent on their skin, how bad their melasma is, how I feel they're going to respond to treatment, how compliant I think they are. So there's no one fits all like compounded mix. It's really variable and it depends on the patient. So that's why working with a doctor who understands the treatment and also understands your skin and the skin problem is really important. I have a lot of experience treating melasma. I've seen it in all different skin types, and I've seen it get better in all sorts of skin types and all sorts of people. So you need to find someone like me to do it for you. So then every month, depending on the response of the patient or your response to treatment, I then change the cream. So we can stay at 10% hydroquinone for another month, another 2 months, another 3 months, 4 months. I have a patient who's been on 10% hydroquinone for over a year. Her melasma is clear, but she's really scared to come down in strength. I've taken the morning cream away, but she will not stop the 10% at night. And she loves to use it. It makes her skin glow. She's very happy. She has no melasma. Her skin's totally fine. So not everyone is like that, but I have some patients like that. And that's totally fine. So as long as I communicate with the patient, it's under medical supervision, no problems there, okay? And also the tretinoin is great for anti-aging, fine lines, and whatever. So she's a happy patient. Most of my patients, pretty happy patients. The only other thing I may add into treatment is oral tranexamic acid. So I'm actually going to look at this on my screen because so tranexamic acid is a tablet that you take to lighten your period. And it works to lighten your period because it stops the breakdown of a protein called fibrin. Sorry, I have to look at this on my screen because fibrin is one of the main components of a blood clot. So that's how tranexamic acid reduces blood flow. But it's quite complicated how it works in melasma. Now, it's been used in melasma since 1979. So it's not like a new treatment, but here's a step-by-step explanation. So here we go. Are you ready? Plasmin is found in keratinocytes, which are skin cells, and it induces the production of arachidonic acid and alpha melanocyte stimulating hormone. Okay. So arachidonic acid and alpha melanocyte stimulating hormone stimulate the production of melanin by melanocytes. So melanin is skin pigment, and melanocytes are the cells that make the pigment. So that can lead to melasma. Stay with me here. Plasminogen activator is required to make plasmin do what it does in the keratinocytes, okay? Plasminogen activator has lysine binding sites on it, and these sites need to be stimulated to activate the activator to then go on to get plasmin to do its thing. So tranexamic acid, are you still with me, is a synthetic derivative of the amino acid lysine, so it looks like lysine. So it can bind to the plasminogen activator site instead of lysine, and therefore blocks it from activating it in the first place. And that's how it works to reduce melanin production. So when patients ask me that question, how does tranexamic acid work? In clinic, I'm always like, okay, so there's something with plasminogen activator and it's like a process and I cannot describe it to you right here, right now, but it's going to be in the YouTube video. So that's how it works. Now, there have been some good quality studies that have looked at 250 milligrams twice daily of tranexamic acid in the treatment of melasma. It can be quite effective. I add it in with my topicals. I don't treat melasma just with tranexamic acid, though I do know people who have done that. I generally like to do everything because most of my patients want the effects of the tretinoin as well. So that's what it comes down to. Basically, the treatment of melasma involves 2 or 3 things. One is using hydroquinone and tretinoin at night, using hydroquinone and something else in the morning, like glycolic acid, and maybe adding in tranexamic acid. It's not the appropriate treatment for everyone. So tranexamic acid can stimulate blood clots. So if you have a history of deep vein thrombosis, pulmonary embolus, or some type of clotting problem, you cannot take tranexamic acid. So not everyone can take it, but also not everyone needs it. And that is how melasma is treated properly. No lasers, no funny treatments, no light masks, none of that jazz, just a good quality topical. And if you want to know how much the creams cost, somewhere between 30 and 60 pounds. Okay. So they're not mega expensive. They shouldn't be because they're compounded treatments. They're generic drugs and they're made in a lab. So somewhere between 30 and 60 pounds, depends what country you're in, and the size of the container. So, and that works really well. Any questions you have, please let me know. But that is how I treat melasma, and I treat it very, very successfully. So there you go. I hope that was helpful.